Recording in progress.
Hello, everybody. Thank you for joining us today. Sorry about the delay. We had a couple issues with our Zoom link. Over the past several weeks, Northeast Ohio has experienced a significant surge in COVID-19 patients. In addition, there have been several updates on COVID-19 therapeutics and vaccine eligibility. So we wanted to give everyone the opportunity today to hear from our COVID-19 experts at Cleveland Clinic and University Hospitals about what the health systems have experienced and where we may be headed in the future with the pandemic, as well as give you all an opportunity to ask questions. The speakers are going to make some brief comments, and then we'll give you the chance to ask questions. If you have a question, please write it in the chat, and we will answer as many as we can following our speakers' comments. Joining us here today are Dr. Robert Wiley, Chief of Medical Operations at Cleveland Clinic. Dr. Wiley also leads Ohio's Zone 1 in COVID pandemic response, which includes Northern Ohio. Dr. Dan Simon, President in Academic and External Affairs and Chief Scientific Officer at University Hospitals Health System. Dr. Hassan Cooley, Chair of Critical Care Medicine at Cleveland Clinic, and Dr. Claudia Hoyen, Director of Pediatric Infection Control at UH Rainbow Babies and Children's Hospital. We are going to start off with Dr. Wiley. Dr. Wiley, go ahead.
Thank you, and it's a pleasure to be here today with Dr. Cooley, along with our colleagues from University Hospital, Dr. Simon and Hoya. So, since the beginning of the pandemic, Cleveland Clinic and University Hospitals have been cooperating literally on a daily basis in order to provide the best care for not only the people in our healthcare systems, but among all the hospitals and all the potential people who needed to be hospitalized in Northern Ohio. Some of the things we did was set up a common transfer line so that no individual health system or hospital became overwhelmed, and we would load balance patients and bring them into other areas that had capacity, and we're still doing that almost on a daily basis. We also developed common protocols in terms of testing as well as immunization practices, and we took responsibility for long-term living centers in terms of who would go in and test those centers when there was an infectious outbreak, and then we would cooperate on developing analytics and looking at where outbreaks occurred. So let's see how we've done during this last surge. So the surge actually peaked about a month ago, averaging over 7,200 patients a day. I'm delighted to say we're now down to less than 3,500 as of this morning. Hospitalizations have dropped from over 3,700 to this morning we're down to under 2,500, so a drop of over 34%. Although we still have 426 patients hospitalized in Cuyahoga and the surrounding counties, so we still have a challenge to go through. In terms of the number of vaccinated people in the state of Ohio, as we look at the total population of the state, about 55% of the people have received at least one vaccine, and 51% are fully vaccinated. Fortunately, with those over 65 years of age, 84% are fully vaccinated, and 88%, just over that, have received at least one vaccine. As we move into the fall, we're glad that we see the numbers going down, but we're concerned about what might happen as we look at the winter and the deep winter surge that we had last year, and people getting back together indoors because of the cold weather and gathering because of the holidays. But we can do something to mitigate any other surge that we might have, and that is we urge everybody to be vaccinated and to take some simple precautions when they're together. Thank you.
So much, Dr. Wiley. Next up, we'll hear from Dr. Dan Simon.
Good afternoon. It's a pleasure to be here, and thank you to my colleagues at the Cleveland Clinic. There's a lot of room for excitement today. We now have within our hands the Tamiflu equivalent for COVID-19. So many of you know we tackle influenza with both vaccination as well as an oral antiviral that we try to start within 48 hours of flu symptoms if there's breakthrough. The good news now, many of you have heard about the new antiviral from Merck and Ridgeback Therapeutics called molnupiravir. That was tested in a phase 3 clinical trial called Move Out, which looked at patients with mild to moderate COVID symptoms within 5 days of symptom onset. This oral pill, 4 pills in the morning, 4 pills in the evening for 5 days, a total of 40 pills, reduced hospitalizations and severe disease by 50%. Interestingly, there were 0 deaths in the molnupiravir group and 8 in those who received placebo. The good news about this oral therapy, it's only $700 a course, much less than the $3,000 for a monoclonal antibody. There's no need for an IV infusion, so it's much more convenient. And subgroup analysis from the study showed that it was equally effective against all variants, including Delta variant. So good news on that front. Molnupiravir is at the FDA right now for EUA consideration, and we believe it will be available to patients by November. Some of you have heard about exciting data, preliminary, but published in Lancet, so it has undergone peer review with fluvoxamine, which is a selective serotonin uptake inhibitor used for obsessive compulsive disorder, a very cheap generic drug that reduced similar endpoints as molnupiravir by about 30%. So I think it is important that we look at the results of the study, about 1,500 patients from Brazil, to see how we will move forward with yet another tool in our toolbox against COVID-19. Finally, of course, a lot of action on vaccination. I'll leave it to my pediatrician colleague, Dr. Hoyen, to speak about 5 to 11-year-olds, and then the little kiddies 6 months to 4 when she speaks. But good news this week related to now starting boosters, not only for Pfizer, but in addition now, Moderna and Johnson & Johnson. Pretty easy and convenient now. Anybody 65 and over or a resident of an assisted living is able to receive a booster shot. 18 to 64 is largely based on your medical conditions or your high-risk environment, either as a bus driver, a subway operator in our food chain, and most importantly, healthcare workers. Mixing and matching has been allowed to provide convenience for individuals who may not have access to the same vaccine. So certainly mRNA vaccines are preferred. And if you did receive Johnson & Johnson, all Johnson & Johnson recipients are able to receive a booster 2 months after a J&J. But there is an overwhelming consensus, I think, by infectious disease experts that boosting with an mRNA vaccine would be preferred. So with that, I'll pass it along and be happy to take questions.
Thanks, Dr. Simon. Next, we'll hear from Dr. Hassan Cooley.
Good afternoon. It's a pleasure to join Dr. Wiley from the Cleveland Clinic and our colleagues as well from university hospitals. This current surge, dominated by the Delta variant, has been very tough on our ICUs. Our ICUs have been quite busy. Our ICU teams have been working very hard to be able to manage patients with COVID-19 infections. The patients that we are seeing currently in our intensive care units within the Cleveland Clinic in Ohio are very sick. They're requiring life support treatments. They're requiring life-sustaining treatment, including ventilators as well, too. We are seeing approximately between 90 to 100 patients this week of COVID-19 patients coming to our intensive care units. And that is a significant number of patients to be able to manage throughout our intensive care units, too. This is not just impacting the care of patients with COVID-19. This is impacting the care of patients who actually come to our ICUs with other important life-threatening infections or diseases that require intensive care unit admissions too. Our teams are being very impacted as well. They have been going through this for a long time. Since early last year, this is a long marathon that has impacting a team of caregivers that are very committed and divided and dedicated to the care of patients, all patients who need to come to our Cleveland Clinic hospitals, including COVID-19 patients. What's unfortunate about this current surge is that it is really preventable. We are currently at a time where vaccines, effective and safe vaccines, are available to prevent COVID-19 infections. And what we're seeing currently is that most of the patients, approximately 90% of patients who come to our hospitals, to our intensive care units, are the unvaccinated patients. We do see sometimes patients who are more vaccinated who get COVID-19. These tend to be the very older patients, patients who have certain medical conditions that make their immune system more vulnerable to COVID-19 infections. We're seeing more and more young patients, patients who are young and requiring life support treatment, including ventilators, and some of these patients, unfortunately, are dying from this disease too. What we are also experiencing in our intensive care units is a call or request by some families for some unproven treatments. That has been complicating how we need to manage our patients and focus on the science and focus on what's evidence-based medicine, something that we have done throughout the history of the Cleveland Clinic and our sister hospitals in Ohio and beyond. That is really an important factor because, what we need to do, we need to focus on what works and what's effective in preventing COVID-19 as well in treating patients with COVID-19 infections. And we're going to continue to do that. Our clinical outcomes of patients who come with COVID-19 infections to our intensive care units are actually very favorable and reassurance compared to what we see outside. So we know focusing on evidence-based medicine, focusing on what it works will do. It is quite important as we get into this holiday season and the winter, as Dr. Wiley mentioned, to really focus on preventing the infection, COVID-19 infections, by being vaccinated and by doing the things that we know have been working. Social distancing, being responsible, wearing masks, and hand hygiene that has been proven to be effective in caring for these patients and in really preventing the infections too. So our teams who have been working extremely hard will be able to get through this and continue to care to all patients in Ohio who need and seek our help. Thank you for the opportunity, and I'll be happy to answer any questions that might come up later.
Thank you, Dr. Cooley. And lastly, we'll hear from Dr. Claudia Hoyen.
Thank you so much for including me in this esteemed panel this morning, and excited to be working with our counterparts at the Cleveland Clinic. I am going to give the perspective of the little people, those who are under 18, and kind of what we've been seeing in the pediatric population of Northeast Ohio. At Rainbow, fortunately, as Dr. Wiley told us, our numbers across Northern Ohio are coming down. We are seeing that as well. But we did see at one point 10 times as many COVID patients as we had been kind of over the later summer and early fall. So unlike the other surges in the past, this time, pediatric hospitals were very impacted. And so as our colleagues from the ICU at the clinic saw and our colleagues on the adult side here, we got to a point where our beds were very tight. Again, people are working, above and beyond to do whatever they can for the patients. And so it is important that we all do whatever we can, whether it's for our children or ourselves, to keep us healthy as we're going into the winter. Currently, the rate at UH for kids who are symptomatic, who test for COVID, is about 10%, which is certainly down in the last couple of weeks. Interestingly, the asymptomatic rate is still sitting around 3.5%, which is a little bit higher than I thought it would be. But again, it may be that, as we know, children have fewer serious infections. However, that doesn't mean that we shouldn't be sure to get our kids vaccinated as we can. An interesting thing that the CDC has been talking about in the last week is, as they've reviewed all of the cases in the different age groups, and as they've been preparing for talking about the Pfizer vaccine for children ages 5 to 11, they've noticed that over 100 children in that age group, 5 to 11, have died. I can tell you that that is probably almost double over what would have died of the flu during that time. So when people say this is a lot like the flu, actually it's much more serious. When looking at those deaths in pediatric patients in that age group, COVID is now the 8th leading cause of death of children in this country. So again, it's really something significant. Again, the children are less likely to become seriously ill, but I can tell you, if it is your child or your grandchild or a niece or a nephew or a friend, it makes all the difference. The other thing that we're really, worried about in the upcoming weeks is the side effects from this surge for kids who may have had mild COVID or perhaps just been hospitalized and not necessarily in an ICU. We did see children within our ICU who, as the adults, were on ventilators. We had several children on a more higher level of life support in terms of ECMO. Fortunately, during this surge, nobody at Rainbow passed away, but again, children who were very severely ill and most of them being unvaccinated. So as we're going into the next few weeks, we're still worried about what is to come for those kids who may have had COVID. The things that we've started to see within the children, and which we know we'll be seeing in a couple of weeks, one is MIS-C, which is the multi-inflammatory syndrome of children, which is kind of your body's response to the actual virus. You have the illness, and then for some reason, your immune system doesn't turn off. It can be quite serious. And again, these patients can require ICU care. Many of them develop a myocarditis, and we've had several in the past who have also been on life support like ECMO. So again, although the chances of an individual child becoming very sick and needing life support is low, it is not zero. And we have certainly seen families and children suffering during this part of the surge. The other thing that we are really starting to see that is quite disturbing is the number of children with long COVID. We currently have a clinic at Rainbow for these children, and we are seeing children actually from around the state who are suffering after they've had COVID, having things like brain fog or persistent symptoms, either GI or a cough. A lot of the children also going on to develop kind of a fibromyalgia, just really not feeling well, having a lot of aches and pains. And some of these children have been suffering actually since last year. So more to come on that. And just another reason for parents and those caring for kids to get kids vaccinated. As we know, this, for me, having done infectious diseases for the last 25 years, the last month has really been very exciting in that we have had the vaccine approved, given an EUA for the children who are 12 to 16 for the Pfizer vaccine. And as recently as 2 days ago, the group who gives the recommendation to the FDA, so a group of experts from outside of the FDA, reviewed the data on the Pfizer vaccine in children 5 to 11 and recommended almost unanimously that the vaccine be moved forward for approval by the FDA. So it's, that doesn't mean everything will start tomorrow. As we know, there's a bit of a process with this. The FDA will probably be meeting in the next couple of days to make their final determination. And then their recommendation will go to a very similar group at the Centers for Disease Control, who will also review all of the data and then make a decision about whether they are going to recommend the vaccine to the director of the CDC. And if that does occur, then the director will then recommend the vaccine be given to children 5 to 11. I know that within Northeast Ohio, we are all doing what we can to be sure. Our colleagues at the clinic, as well as we're following kind of the national and state mandates, which is when vaccinating kids, we know the best place for them to get their vaccines are in their pediatrician's office. And so it's important for anyone who's considering getting this vaccine for their child to be in touch with their pediatrician's office. If for some reason you don't have a pediatrician, I know at we'll have a few mass clinics around town, as well as our colleagues at the Cuyahoga County Board of Health will also have clinics. But again, as we know, it's really best and safest for children to get their vaccines from their physicians. The other thing that I know that people are really worried about is what can we expect? Are we worried about side effects in the kids? And of course, the studies have been done on several thousand children in this age group. And the outcomes in terms of the efficacy of the vaccine are great. It's about 91%. And the side effects, again, were very minimal. Really things like fever, aches and pains, those types of things that you might expect when getting a COVID vaccine. I know the one thing that people have been worried about, and rightly so, is the incidence of myocarditis that we saw as we rolled out the Pfizer vaccine to young adults. They're really in this cohort of patients, there were a couple of things. One, they did not see any cases of myocarditis in the study from 5 to 11. But again, once we get it out in the general population, we may start to see a signal. The other thing to think about is that as we vaccinated the 12 to 15-year-olds, that group has not had as high an incidence of myocarditis as the people who were 18 to 30, those young men 18 to 30. And so again, it seems that this is less of an issue in children, but of course, we'll all be monitoring closely to be sure. I think the third really important thing that I know parents are worried about is, if my child were to get myocarditis from the vaccine, what does that mean? When we look at children who develop the myocarditis from the vaccine, those children are typically very mild. We've seen some at Rainbow over the last few months. But again, those are kids who are coming in maybe for a day or two into the hospital, maybe in the ICU, but certainly not on any life support. And then what we have seen, though, is as children, if children were to get myocarditis from the actual COVID vaccine, those children are much sicker. And the incidence of myocarditis in children with the actual COVID virus is about 10 times or 10 to 100 times higher, depending on the data that you're looking at, than from the vaccine. So with all of that, knowing that kids can become critically ill, knowing that there are side effects for kids, and knowing that the vaccines are very safe and effective, as these groups are looking at the data, they really, really feel that it is definitely the benefit of these vaccines for children outweigh the risks. There are other things that we worry about, not just the medical component of what's been going on during the pandemic, but clearly one of the most impactful things during these surges and this pandemic for children has been the disruption to their daily lives. And we can see this each and every day as more and more children are being referred to our healthcare systems with behavioral problems and anxiety. It is critical that we keep kids in school, we keep them in school safely. And we know, as we've talked about, what those tools are so that we can be together safely. It's vaccination, masking, distancing when we can, and hand washing. And these are things that we need to be doing for the children of Northeast Ohio so that they can stay in school, without disruption and be able to get back to their normal lives. Because as I said, this has been a long 18 months for everybody, but especially our children. And they all deserve to have a future where they can thrive. And so we need to do what we can to ensure that future for them. I know there are things that parents are also worried about. As I said, we've seen just a huge influx of children within our system with behavioral problems. And, we have kids who have anxiety and depression due to all the things that are going on. But again, if we can get them back to their normal schedules, we're hoping that we will see a downturn in these symptoms in our pediatric patients. The other thing I know that people are wondering about, since it's coming up this weekend, is should we go trick-or-treating? I think we've all seen that Dr. Fauci gave it a resounding yes, and I would agree. Trick-or-treating is certainly something that we can do safely when we're outdoors. We can be together. If we're deciding to trick or treat in a really large group, perhaps wearing a mask if it's not people that we've kind of potted with. But otherwise, if kids are running around and having fun outside, it's really a great time to let them have a little bit of normalcy in their life. So would certainly encourage that. And I know my other colleagues have talked about the holidays, so I don't need to spend a lot of time on that. As the CDC has said before, if you're not vaccinated, they really feel it's high risk for you to travel. And so again, we have a way to get lots of people vaccinated in the next couple of months and get ourselves ready for the holidays so that we can be together safely. I am also happy to take questions about the pediatric patients, and I will turn it back over to our host.
Great. Thanks so much, Dr. Hoyen. We are going to start taking some questions now. So if you have a question, go ahead and write it in there in the chat. We'll get to as many as we can. So we are going to start off. We had a few questions here about the winter. Let's start with Dr. Wiley. Are we expecting another surge this winter? And if so, do we expect it to have a similar outcome as last winter?
So as I indicated in my previous comments, just over 50% of the Ohioans are vaccinated at this point. So there's still plenty of people to potentially become infected. And that's why we're very interested in pursuing vaccination for those who have yet to get the first dose of a vaccine, which is about 45% of the population. So with that, it's hard to know exactly, but we would not be surprised. We're looking at cycles of infection, and we really don't understand the biology of the virus well enough to know why we have these rapid upswings in cases and then a plateau and then a downswing, and why these surges occur. This is either the fourth or fifth surge in the United States, depending on how you look at the surges and how you look at the peaks and valleys. So I don't think any of us would be surprised if we didn't see an uptick again in the months of November and December or January, as we did last year. But again, we do have the opportunity to mitigate it if we get more people vaccinated, and if people, not only in Ohio, but around the United States, who need boosters because of waning immunity with the vaccine, which the CDC and the FDA have talked about, if those people get their boosters in order to prevent them from becoming hospitalized.
Dr. Wiley, if I could just add, the other thing, that we're worried about on the infection control side is kind of a twindemic. And so I would encourage everybody also, as we're preparing for the holidays, to make sure that everybody gets a flu shot. We know that over the last couple of months, respiratory viruses, as you can hear from my voice, have been running rampant as we've all taken our masks off in certain situations. And so, our pediatric ICU is as busy with children who have RSV, which typically comes in the winter, but this year came in the summer, as we are with COVID patients. To think that we might have the flu added on top of that, I think is pretty scary. And so again, encouraging everybody to do what they can. As Dr. Wiley said, get your booster, get your shot, and also consider getting your flu shot at the same time.
Great, thank you. Now we have a similar question from Lisa Ryan and at WCPN and Jade Jarvis at Channel 5. They're both asking about staffing challenges at the hospitals. Lisa asks, how are you preparing for a potential additional surge, especially with staffing challenges at the healthcare systems? And Jade Jarvis is asking, can you talk about nursing shortages during the pandemic and the incentives and bonuses that are being offered to nurses if they pick up extra shifts? Is that happening at the clinic and UH? I think we could start with Dr. Simon at UH, and then we could go over to Dr. Cooley at Cleveland Clinic.
Well, thank you for that terrific question. As you know, our healthcare workers are stressed. As we've come now on over a year and a half of the pandemic, healthcare workers are tired, they're frustrated, and they are stressed by the fact that about 18% of the nursing workforce, for instance, has left for a variety of reasons, some childcare, some others, and have made an indication that they're unlikely to ever come back. There's probably another 15+% who are considering leaving right now. So staffing shortages, not only nursing, but respiratory therapists, as well as physical therapists, occupational therapists, really across the board is a challenge. We've been able to continue all medical services for our patients with chronic health conditions and acute health conditions. We've not stopped elective procedures or elective surgeries. However, we are fortunate as a 20+ hospital system to be able to load balance as similar as the Cleveland Clinic system. We're able to distribute patients across the health system so that we can accommodate all patients. But we have felt the stressors that have come from the South and from the Far East, where we are having to transfer patients. Many emergency rooms and ICUs were previously on divert. We don't know what will hold for the future. We are, of course, trying to look at creative staffing models, relying not only on nurses, but also using APPs and other care providers to allow us to have a team-based approach to care for our patients. Of course, there's premium pay and incentives to be able to take care of our patients, as there is across the U.S. We are very hopeful that some nurses who have decided to leave temporarily will come back and will reconsider, as there's a greater degree of normalcy in their life, to come back to nursing, even if it is on a part-time basis.
Thank you. Dr. Cooley, anything you want to add from the Cleveland Clinic perspective?
Thank you for your question. This is a very important question. And as Dr. Simon mentioned, we have been going through this for a long time. Our teams have been under a lot of stress for a long period of time. Having said that, we have been able to continue to provide the care that we need to provide by caring for our teams and by also continue to care for our patients throughout the vast network of hospitals that we have within the Cleveland Clinic in Ohio too. We do daily huddles where we actually look at our census, our needs at different hospitals within the Cleveland Clinic in Ohio, and we're able to rebalance and move patients when we need to, and support our staff as well throughout the ICUs and throughout the hospitals there. And that has been an important collaboration and integration across our system to be able to support what we're going through there too. The nursing staffing and the respiratory therapy staffing, among others, it's a national crisis. This is something we all have seen and we are experiencing, and it's impacting certainly, in terms of how we manage here. We have been able to continue to provide all the services that we need to provide. Many of you know that Cleveland Clinic receives many patients from even outside the health system, and the demands for that, the calls to bring patients in COVID-19 or otherwise, has actually also increased considering what the other systems are going through. So that has provided an additional strain on staffing and what we need to do. We have been able to help as much as we can while we care for our teams and manage the stresses that we have in that area. We leverage the big system that we have, and we provide some of the incentives that you have heard about too, to be able to support the team too. Our respiratory therapists really our advanced practice providers too, and a number of our staff have been impacted by this too. So this does not seem to be preserving or saving any, any specific caregivers being affected by this too. We know we're going to need to continue to do that for the future because we don't really anticipate that these staffing challenges are going to be ending anytime soon. We have learned a lot during this pandemic, how we manage and how we leverage the big system and the resources that we have. And we appreciate also the help of the communities to do the things that we talked about earlier so it can mitigate the impact on our staffings too. Thank you.
Thank you so much, Dr. Cooley. We have 3 different reporters asking about vaccine mandates. Is the Cleveland Clinic and University Hospitals going to put a vaccination mandate for medical and non-medical employees? Dr. Wiley, do you want to start, and then we can go over to Dr. Simon?
Sure. So we're following CDC and HHS guidelines, and we're waiting for specific recommendations to come out from OSHA as well as CMS. Over nearly 80% of all our caregivers at least have received 1 vaccine. So the vast majority are vaccinated. But in terms of we will follow the rules as recommended by CDC, CMS and OSHA when they become available.
Dr. Simon, do you want to answer from University Hospitals?
Yes, well, I would echo Dr. Wiley's comments. We will follow the rulings of HHS and OSHA. Of course, we are about our vaccination rate across the health system is in the mid-80s right now. We are continuing all of our education efforts to get that number to go up. And what I think Claudia and I can tell you is that ongoing education, especially peer education, is very effective with vaccine hesitancy. You know, we are used to seeing influenza vaccination compliance in the mid-90s at least, and that is certainly our expectation for COVID-19. And we will continue to educate, continue to provide easy access, and of course, we'll follow the law as dictated by HHS and OSHA.
Great, thanks, Dr. Simon. We have a couple questions here from Matt Wright at Fox 8. Dr. Simon, this might be a good one for you. The latest surge was driven by Delta. Are there other emerging variants of concern?
Yeah, that's a terrific question. And the answer is most definitely yes. There is a Delta Plus variant, which has been identified in the UK that has additional mutations that, at least in vitro, is associated with enhanced ability to infect cells. We don't know yet its clinical impact at this time. In general, the more unvaccinated people you have, the more opportunities that you actually have for virus replication, which is always associated with mutagenesis. And so the way to get around new variants is to vaccinate more people. And it's one of the main drivers of global vaccination. Unfortunately, Sub-Saharan Africa has a rate of vaccination which is less than 5% of the population. There certainly have been extraordinary pushes by the WHO with respect to the AstraZeneca vaccine. Pfizer has advanced global access, and I'm sure you have all heard that Moderna as well. We need vaccination in the US, and we need vaccination globally to prevent the emergence of new variants. I am very confident, however, and many of you have heard, that both Moderna and Pfizer currently have trials with mixed variants to be able to show the FDA that either vaccination with Delta or Beta variants, for instance, can be very effective. And so these trials are underway to help convince the FDA that quick adjustments to booster vaccination, similar to what we do for strains of influenza, will allow us to stay ahead of the viral mutagenesis.
Great. The next question, we'll start with Dr. Hoyen and then go over to Dr. Wiley. Can you tell us more about what mass vaccination clinics for children will look like at UH and then at Cleveland Clinic?
Again, we are encouraging everyone as they can to see their primary care provider, because I know that within both of our systems, our primary care providers stand ready to give the vaccines. In terms of the other locations, we don't expect the volume to be as high, and we'll have dedicated days to having the children get vaccinated so that they aren't necessarily there on a day where we might use that for older people to get boosters. So again, not as high volume as we were seeing in the spring, where long lines of people waiting in their car to come in. We don't expect that many people to get vaccinated because there are only 28 million in this age category. But again, set up in a same situation where we'll bring the kids in, get them vaccinated, and get them out as quickly as possible.
Dr. Wiley, do you want to mention what the Cleveland Clinic is looking at doing for vaccinating children?
Yes, at the Cleveland Clinic, we'll have over 80 sites in our primary care areas where children can be vaccinated. Their parents can bring them in to their family physician or to the pediatrician's offices, as well as we will have opportunities for our larger vaccination sites that'll be on the main campus, Fairview and Hillcrest Hospital. So we will have both. The vaccine is a little different. The Pfizer vaccine, which is being talked about, is about a third of the dose, but it's a new formulation. So we have to be careful to make sure that we're giving the correct vaccine to the correct patients. But we'll be prepared within a day or two of formal approval by the CDC.
Great. And this question is also from Matt Wright at Fox 8. It's directed for Dr. Simon regarding the Merck antiviral. Does UH have a supply of the drug and is just awaiting the EUA to begin prescribing?
No, the supply of molnupiravir will be very similar to monoclonal antibodies and remdesivir. It will be distributed, excuse me, it will be distributed by the federal government to the states. We understand that Merck has presently 1.5 million doses. That will be increased to over 10 million by the end of the year. But no, we will wait for our distribution through the state.
Great. Thank you, Dr. Simon. We have a question here from Lydia at Cranes. Dr. Cooley, we'll start with you, and then if anybody wants to jump in from UH as well. Recognizing that burnout and stress among our caregivers, what supports have you expanded or added for staff?
Thank you. This is such an important question to support our teams. And what we have been doing, really, we have been listening to our caregivers, observing what they're going through and implementing a number of things to support them. We have wellness programs that have been in place, providing some additional meals, providing some meditation, providing really some resources for our teams to support them, being able to make some changes with their shifts and where they are, providing them with additional support related to counseling with our experts when they are experiencing things related to burnout. We look at our surveys related to burnout and we learn lessons from them, and we implement some of these things in our, for example, ICUs and also the regular nursing floors there. We continue to work very closely with our teams, and our leadership actually is quite engaged with leadership rounding, working with them and spending time to understand better what they're going through and provide the things that are needed to make adjustments. And some of these adjustments are being made on a regular basis, weekly or monthly basis too. There we have a lot of food stations that are being actually set up across our ICUs and across our regular nursing floors there too, to provide some additional support to them and to their families as well, too. So some of our caregivers who need to care for their families are receiving the support that they would need.
Great, thank you. We have one last question here in the chat, also from Lydia at Cranes. Dr. Simon notes that the way to avoid new variants is vaccinations. Will vaccinating children have a substantial impact on that? And what hope do the doctors have that adults who've thus far resisted vaccination will eventually change their mind and move the needle on that mid 50% Ohio vaccination rate? Dr. Hoyen, do you want to start off with that question?
Sure. Again, any people that we can get vaccinated, if they're in the age group of 5 to 11 or older people, the more people that are vaccinated, the better off our outcome is going to be. Again, right now, the vulnerable population really is the smaller children because they have absolutely no opportunity for vaccination until hopefully next week. And so we know that we've also put this group back into school, and so they are at risk. And they are at risk for getting COVID, not typically in the classroom, but sometimes within the setting of other things that go on with schools, say sporting events or outside time with friends from school. So again, and if children are getting sick, they certainly can transmit to adults. So it is going to really be critical that we go ahead and get everybody vaccinated. I would hope that at this point, if people are still undecided about getting a vaccine, that they work with their healthcare provider, get the information that they need, and to think about it a little bit differently. Again, if you feel that you're not at risk or at high risk, I would ask that at this point you take the vaccine for somebody in your life that you love. Again, like I said, it's really critical that we keep children safe. And until we're able to get a large number of them vaccinated, as we know, the babies, the 0 to 4-year-olds, 6 month to 4-year-olds aren't going to be able to be eligible probably into 2022. So again, whatever we can all do to take care of those that we love and take care of those within our communities to ensure that we can move forward.
Great. Thanks so much, Dr. Hoyen. That's all the questions we have, and we are right about at time. So I just want to thank everybody for joining us today, and thank you so much to our physicians for taking the time to answer these important questions. If anybody has additional questions or if you need extra details on the questions that we addressed here today, follow up with the PR team from either UH or Cleveland Clinic. And also we will be posting these recordings on our respective newsrooms, which you should see here on the screen. So thanks again. Have a great day, everyone.